Welcome back to my channel, Pharma Training Solutions. Today I'll be talking about importation, exportation of pharmaceuticals and how donations are handled. So, because most drugs in Uganda are imported from other countries such as Germany, UK, any other country, India, China, and other European countries, Arab countries, Asian countries, but also we import from African countries, Kenya, Egypt, South Africa, and any other country. Most drugs which are imported into Uganda also incur tax. We import because requirement of specific drugs and brands, donations from other countries, organizations, during clinical trials, and some patients which may need specialized treatment or drugs which are not available in the country. Now, what are the requirements for importation? All drugs to be imported into a country must be registered unless given special clearance by NDA. First, should have a valid import permit, should be either annual for regular importers or provisional for non-regular importers. You need a verification certificate per Proforma invoice. Need an Indamis account as everything is being done online. Proforma invoice and a packing list. The procedure for importation. Of course, any importing pharmacy or organization must be registered with NDA, and all applications are made through Ndamis. Apply for a verification certificate by submitting a copy of the Proforma. However, if you're a non-regular importer, you have to first apply for provisional import permit, then you pay fees, and then you apply for a verification certificate. Now, payment of prescribed fees for a certificate of verification. Once issued, items are shipped. On arrival at the port of entry, the drug inspector, of course, inspects a consignment based on the Proforma and verification certificate. They should be aligning. Did you put in something else which was not approved initially? Now, a sample is picked from the consignment for analysis to ensure it conforms with quality. Once it is cleared, authorization is given and released to the buyer or the importer. However, from time to time, queries may arise which may need clarification through email. Of course, you have to ensure that you reply these queries. And sometimes the consignment is rejected and sent back to the country of origin or destroyed at the expense of the importer. Now, exportation of product is the other way, but in the opposite is the other way. Of course, you should have an export or provision export permit in order to export products from Uganda. Of course, this is also issued by NDA. Applications is made through Ndamis and orders received from intending importer, and you send a Proforma invoice to them. Once they send authority from their drug authority, and then you have paid prescribed fees, an export permit will be issued. Products are then exported, and then the consignment is inspected before export by the regulatory officers. However, with narcotics is a different story. Of course, all of us, we know the narcotics, the morphines, and all those drugs. They have a special method they follow, procedure they follow. Of course, any pharmacy intending to import narcotics into a country should have an annual import permit, but also a special narcotics import permit. All these are issued by NDA. An application for verification certificate is made in a prescribed form, and then you pay fees. Of course, the certificate is issued. The exporter from that country also applies for a special export permit from the regulatory authority. On inspection of the consignment, the special narcotics permit, verification certificate, and special export permit are presented at the ports of entry. A sample may be picked from the consignment for chemical analysis to ensure it conforms with quality. Once cleared, authorization is given and products are released to the importer. Now, donation. Of course, donation, this is a gift for charity or humanitarian aid from one organization to another. This occurs during disaster or suffering, or some organization reach out for help and the pharmaceuticals from other countries. What are the WHO core principles of donation? There should be maximum benefit to the recipient. Respect for the wishes and authority of the recipient. No double standard in quality. There should be effective communication between the donor and the recipient. However, there are problems with donations. They may not be relevant in an emergency situation, unfamiliar to the local health professionals. The drug may not be registered in a given country. They arrive unsorted, labeled in the foreign language. Some of them may be of questionable quality. They may be of short expiry. This one is key, short expiry. High declared value, of course, this one leads to higher import taxes. Requires special storage which may not be available at the facility. And sometimes large quantities may be donated per the usage, and hence these companies, these facilities will again incur more money in the drug disposal. Of course, a facility intending to import donated products or items should apply for a special import permit because they do not have an annual import permit. All applications are done via dummies. An original Proforma is presented for the consignment of donation or packing list, NDA for assessment, and once you pay the fees, you get a verification certificate. On arrival at the port of entry, the consignment is inspected. If it complies with the guidelines, then it is released to the buyer. These same guidelines will also apply to the clinical trial, during clinical trial, importation of those drugs and clinical trial. So thank you for listening and thank you for watching the presentation. These are other presentations which we have. You can search them. All our presentations start with MPTS, Pharma Training Solutions. Senders can contact us on that email. WhatsApp number is available there. And of course, I remain Wilson Musigwa.